I'm going to invite Deval Desai, Chief Development Officer for DMT, to join us as well.
Okay, and in the third installment of Name That Gene Therapy. Good afternoon, and thank you to the meeting organizers for inviting us to present. It's a pleasure to be here and share the important work that we're doing at 4DMT. As a reminder, I may be making forward-looking statements, so I'll direct you guys to our SEC filings and our websites for additional details. So over the past year, we've made a number of strategic decisions, the most important of which is to narrow our focus and really concentrate on our retina development program. Our lead program, 4D-150, is in phase 3 development for wet AMD. Currently, 2 phase 3 studies are enrolling patients globally. Of note, 4D-150 is the only intravitreal gene therapy that has RMAT designation by the FDA for both wet AMD and DME, as well as PRIME designation by the EMA for wet AMD. There's 2 things that set 4D-150 apart from every other gene therapy that's been talked about today. And the first is the R100 capsid. The capsid was selected because of 3 main points. First, it is the most efficient capsid we've seen to date that is able to penetrate the ILM. Second, the ability to selectively transduce cells of the retina. And third, probably the most important, being able to be dosed at a low dose via standard 50 microliter intravitreal injection. The second thing that sets it apart is its dual transgene payload. 4D-150 is the only gene therapy for wet AMD that delivers a dual transgene payload, allowing for continuous expression of both aflibercept as well as a VEGF-C silencing mRNA. Now, over the past 20 years, and folks have talked about this previously, we've done a really, really good job turning a blinding disease into a manageable chronic condition. But our standard of care requires frequent injections that very often lead to fluctuating anatomy, patient discontinuation, and in the long run, visual outcomes that are less than ideal. We think 4D-150 addresses these issues by becoming the first backbone therapy for AMD, providing a basal level of VEGF suppression for all patients. We think 4D-150 can address the largest unmet need in wet AMD, sustained efficacy with fewer injections. And we're not the only ones that believe this. Szilárd mentioned this already. In this year's past PAT survey, the retina community spoke, with gene therapy outpacing all other modalities in terms of the most excitement in the development of the wet AMD space. And that encouragement is not without reason. Early phase studies from ours and other programs have shown unheard of, unseen before treatment burden reductions. And if you look at the early phase studies showing 80% or greater treatment burden reduction in a wide cross-section of patients, on the left showing our most recalcitrant, hard to treat patients, and on the left-hand side showing essentially treatment naive or recently diagnosed patients. Most of these patients over 52 weeks need minimal supplementation of anti-VEGF. In fact, for those patients on the very left-hand side of the screen that most closely resemble the phase 3 population that's currently being enrolled, 87% of patients made it to 52 weeks with 0 or 1 injection. Of course, none of that is possible without safety. And to date, the 3E10 phase 3 dose remains extremely well tolerated. None of the things that keep us up at night, RAO, vasculitis, hypotony, endophthalmitis, was seen in the phase 2 program. The IOI that we did see occurred at a rate of about 2.8%, showing up as 2 cases of +1 vit cell that were present at 1 visit and resolved by the next. Most importantly, patients finish their steroids and they stay off their steroids. That brings us to the phase 3 program. As I had mentioned earlier today, it is the only intravitreal gene therapy that is currently enrolling 2 phase 3 programs. Forefront 1 is enrolling treatment-naive patients in North America, and Forefront 2 is enrolling treatment-naive and previously treated patients across the globe. Enrollment is going extremely well, and we're looking forward to sharing top-line data when it becomes available in 2027. Thanks for your attention.